I'm going to be briefly going through the mental health sort of gap analysis in universities, and this is based on a case study of LUMS, based on two surveys that were carried out. Next, please. And the thing to basically realize is that they were both self-reporting surveys, so all the biases and all the issues and problems that come with those apply in both of these cases. It was conducted LUMS. Both of them had approximately 700 responses, and they were, circulated via email and on social media on closed LUMS groups. Next, please. So the first survey was conducted in November 2015. We got 768 responses, which is roughly, at that point, 20% of the student community at LUMS. This was based on Beck's depression inventory, and I later realized that maybe this was a little outdated, but it gives us sort of structure of what we're looking at. So I'm just very cursorily going to go over it. So we looked at generally the demographics. NOP stands for the National Outreach Program, where LUMS sort of reaches out purely based on merit, and they fund the entire education. But then at the same time, there is a more stringent cutoff with regards to the GPA and the grades that you have to maintain to sort of stay on that. Next, please. So this was basically more important to highlight the drug abuse. So 8.7% admitted to doing drugs, 5.3% to alcohol, and other such coping mechanisms. But if you ask them why they started, the biggest reason by far is academic pressure, followed by feelings of sadness, loneliness, or pain. This is something that I wanted to draw attention towards. So just based on that, and again, self-reporting, so all of those things come with it. If in case you can't read, 0 is I don't have thoughts of killing myself, and number 3 is I would kill myself if I had the chance, at which point we have 57 individuals saying that they would. And again, self-reporting biases withstanding. We can just skip over this, but 12.4% said they have diagnosed mental illness. So this is something that I want to talk about, which is that a couple of juniors took on this survey and they ran a statistical analysis of it. I just want to run through this slide, which is that the business school has a significantly higher percentage of individuals reporting the poorest self-image. Females on financial aid are 10% more likely to report poor self-image versus their full fee-paying counterparts. The BDI scores from the self-report study indicate that 67% of the student body is at risk for at least mild depression. Then they, through cluster analysis, one of the clusters which had individuals partaking in unhealthy coping mechanisms, that corresponded to the highest depression score. So this was alcohol, drugs, excessive tea, coffee, smoking. And then the cluster that comprised entirely of NOP students has the second highest percentage of members in the most depressed category. So that's one thing I just wanted to quickly highlight. Then the second one was carried out in March 2018. This was, however, based on the patient health questionnaire, which, if I'm not wrong, is used by the National Health Services in the UK, and the GAD-7 form. And we can just skip over this quickly. Again, pretty much the same thing, if you can just keep going. So we added basically sort of their monthly income and their academic standing, right, and then we also added whether or not they'd experienced the loss of a close loved one. Of course, the grief exception probably doesn't exist anymore in the DSM, and I'm hoping to get someone to run a statistical analysis on this, and we can sort of, you can just skip through this. Again, the incidence of drug abuse and alcohol and all of that has risen on campus between the two, even if you just look at the individual samples, but again, self-reporting bias plays a huge part. This is something that comes from the PHQ-7, which is if you better off dead or if hurting yourself, not at all the way to nearly every day, and it's on the frequency of these thoughts taking place. And that's basically where we stand, where every day is 140 individuals. Right, so this is the last questions of the PHQ-9 and the GAD-7, which are non-scoring, but it basically says that if you've checked off any, I'm just wrapping it up, in this section, how difficult have they made it for you to sort of cope with your work, with your natural activities? And so 28.3% reported it as being very difficult to sort of cope, and 13.6% extremely difficult. So if you move to the next slide, you'll see pretty much very similar things with the anxiety scale as well. Um, so again, diagnosed mental illness goes up to 18.5%, which is roughly 130 people. And so this was basically just a general overview. But sir, if you could just skip to the next thing. This is a slide I wanted to talk about, which is 41.5% say that there's no adequate awareness of mental health at LUMS. If you go to the next slide, student body, let's just say the red is no, right? So that's 41.6% student body doesn't care. If you go next, the administration really doesn't care. If you go to the next slide, the faculty doesn't care. It's literally this, for lack of a better way of putting it, this pressure cooker that you've just dumped all of us students into, and you're like, okay, let's see how this experiment runs out. If you go next, adequate facilities, LUMS, by the way, has 2 counselors. Two. Whether or not people are happy with them is a completely separate thing. It's pretty much the same story that you've been talking about. But for the sake of what, they still have 2 counselors. Despite that, the larger chunk of the student body says that they aren't adequate. If you include the master's batch, because they had access to the survey, I'm guessing roughly 4,000, 4,500. So again, you can skip through this. This is a long sort of the issues. One of them ended up making me feel worse about myself. All I wanted was her to listen to me, to not be judgmental, and they couldn't provide that. So that for me was very problematic. And this guy, I put it as it was because it was such a raw thing where he says that the counselor gave the answers which I expected, and I had no positive feedback, but an affirmation of the situation, which I already knew existed. I'm just quickly going to wrap up. And so she made me feel worse by making me feel even more hopeless.